Okay, it looks like we are now live streaming on YouTube. So I'm going to, this is Kristen Black, Northborough Health Agent, officially call the Greater Boroughs Partnership for Health Advisory Board meeting to order. It is Wednesday, June 15th. It's approximately 2:03. We're going to follow our Northborough remote meeting script and read this for you very quickly, and then we'll do a roll call vote. So this open meeting of the Greater Boroughs Partnership Advisory Board is being conducted remotely, consistent with Governor Baker's executive order of June 16, 2021, an act relative to extending certain COVID-19 measures adopted during the state of emergency. All members of the advisory board are allowed and encouraged to participate remotely. The order allows the advisory board to meet entirely remotely, so long as reasonable public access is afforded so that the public can follow along with the deliberations of the meeting. The public is encouraged to follow along using the posted agenda unless the chair notes otherwise. Members of the public who wish to view the live stream of this meeting may do so by going to Northborough Remote Meetings on YouTube via the link listed on the agenda. Ensuring public access does not ensure public participation unless such participation is required by law. This meeting will not feature public comment. So members, when I call your name, if you could please respond in the affirmative. We'll start off with Jennifer Sullivan.
Here, Westboro.
Sarah Shiner. Sorry, I just, can you correct me, Sarah? Oh, you're on mute.
Sarah Scheinfein here, Boylston.
Fine, thank you. And Chelsea Malinowski?
Here.
Okay, great. And I'm also just going to state that we have Isabella Caruso is present, our shared epidemiologist, Taylor West with our Southborough public health nurse, Ariel Levinson is our new DPH intern we'll talk about. And we also have Katie Holt is, camera is not on, but she is taking notes and she's Northborough's administrative assistant. Did I miss anything on that? So welcome everyone. Sorry if it's that year-end time, and I know we're all busy and scrambling, but we'll try to move through this and stick within our scheduled hour. On our agenda, our first meeting item is our Public Health Excellence Grant for Shared Services. Really just want to focus in on our fiscal year 22 expenditures. So to date, I'm wondering if I can share my screen now and show all of you exactly where we are on our expenditures. Are you all able to see that right now?
Yep.
Okay. So really our original budget is that column B. That was our original proposal. We made some changes in February and then some additional revisions in May to these line items. So these were mentioned in previous meetings. I'll just talk you through those real quickly. So the way the grant was originally written, I'm going to focus on the blue section, is that there were two lines. There was a health inspector salary line, and there was also a grant administrator. When I wrote this grant and working with Sam Wong, he said, lead agency, Kristen, if you're doing this, write in for 25% of your salary. But there's really, as later as we moved and this grant was approved, and we had our health inspector position was written in at taking Northborough's 7 hours a week, upping it to 32 hours. So it was really adding 25 hours of inspectional services. Those are the two salary line items. There's no way to pay me twice. I can't add hours. So really, I haven't used that line item. There is discussions about, will we hire a grant administrator? Right now, I've been filling the grant administration role, but Northborough is not billing for that. So you can see the revision column C. Grant administrator, we totally wiped out that line item for me, and we'll see what we're going to do next year if we would have some line items for some assistance with the grant administration. We added additional hours or funds to the health inspector line item. What we were doing is that position was sort of backfilling some of what I do to keep up with the day job, but we also realized there were additional sort of inspections that were needed. We didn't realize how sort of far behind we were across the three towns. So that line item did go up to a total of $55,000. Approximately, we zeroed out the grant administrator line item. We also decreased the salary fringe benefits. Northborough didn't fully extend those. So we wanted to make sure we're moving the money around. I just want to remind everyone, this PHE grant, if we don't use it, we lose it. So of the 350,000 total, if we don't find a use, Northborough has to cut a check back to the state of Massachusetts by April 15th, according to my meeting earlier today. So payroll taxes are in there. Those will be fully expended. And the sort of 15% overhead is just standard, and that goes to Northborough to cover support through the various departments, including IT, accounting, that are helping to keep this grant going. So that 15% sort of just static. So we really want to focus on today is everything in orange, and that we're spending this down. So there were some changes that were previously discussed. Again, column C, our health mileage, health inspector mileage went up $550. We took our inspectional equipment line item down $1,000 because we just weren't looking like we were going to use it. Clothing for staff with logos, I was able to increase that by $1,500. All of those clothing orders are in and will be delivered by June 30th. And those order forms went out. Office supply, we increased by $1,000. I got rid of the postage line item. We ended up not really needing it, so you won't see that in the future grant. The technology line item, it's not showing. I did need to add expended. Northborough IT does anticipate that will be fully expended, so you can sort of discount the 12,000. So that's all the iPads, computer workstations for everything from interns to inspectional staff. And then I just wanted you in the gray, it's a little confusing, the at-home COVID test kits, those were purchased regionally, and those were already distributed. That line item is being included now in this new medical supply line, and this was what DPH staff wanted us to do, was to sort of lump that. I want to remind everyone, we do have a per diem clinic staff line item that was added. So if we were to pay additional Salmon VNA nurses, for example, to work any clinics, we've only expended 2,000 of that, but if any of you have clinics planned, there is an additional balance of 5,000. Office furniture line item will be wiped out, and really where we can focus today on where we're going to have some balances and we could possibly get some additional expenditures out in the next 2 weeks are really, there's going to be money remaining, a small amount in that per diem clinic staff. We have a small amount, only 194 remaining in our education and training line item. And then new medical supplies, that's what I wanted to talk about. That's really our biggest amount of money left, is that $12,000 that I'd like to discuss with all of you if there's any additional needs. What we've kicked around before, I do still need to try to lock down the vendor on the blood pressure pocket cards that we talked about, the nurses being able to deliver. That's a small ticket item, only like 400 or 500. If we don't get those in time this year, we may be able to purchase those out of the other grant as well. But any additional purchases that you can think of, I mean, I don't want to turn money back to the state. So my plan is there is additional money remaining. We'll make sure to sort of stockpile on some office supplies line item, and then look to purchase additional masks. Logo Tags was the vendor we used to purchase all those KN95 masks that we distributed to all of you, the surgical mask, the child size mask. Any other thoughts on needs to really use the medical supply line item, so we don't turn it back? Any needs? As we've been dropping off boxes of supplies to all your health offices, you can't think of anything else?
No.
Okay. Would you be in favor of me looking to buy additional masks? I mean, I think stockpiling the various sizes. If we were to purchase masks, is there, KN95 adult, child, what would you?
So I don't know if you filled out the survey to receive the COVID kits and masks. So they're not offering children's masks. So I propose that we purchase children's masks, not the adults.
Okay. That's appreciated. I did send an email on the mask order. I asked him what was the brand, because I know we did request the Mima mask. They're really low quality, and they were really tight and they smelled bad and people didn't want to wear them. So hopefully the ones that we can request for free from the state don't fall into that category.
Right.
I never heard back.
Did you decide how many you were ordering?
I'm just going to look to close out that line item and then do our per capita distribution as we've done before.
Sounds good.
Okay, so we'll probably do a split. The problem is with they come in cases for the most part. So we'll just look to spread that out and more surgical, but that would be a nice back stockpile for our schools. Just to be able to have child size.
Remember, I know I've been harping on this, but thermometers, I know the elderly will love that.
Yep, it's in the meeting minute notes, so we can do that. That's a great one. So we'll look to do thermometers, and that's a great support for our nurses when they're doing these home wellness checks. One of their screening questions, the intake form is, Do you have a thermometer? How are you on medical supplies? And we're just looking, Jen, I was thinking to look to purchase just a standard, inexpensive personal home use thermometer. Is that what you were thinking?
Yeah, unless you needed to spend money, and if you needed to spend money, get the point and shoot ones.
Yep.
Just
Okay.
for the nurse's use, and then you can leave a regular one to the for
Okay,
homeowner or resident.
that works. Any other thoughts on medical supplies or any other of these line items as discussed? We're really close to close out. Once you take out of our technology line item, you know, I don't see us turning back any more than 15,000 this year. Okay.
I
Can you
don't have
move
anything
money
to add.
around in the line items or no?
Say that again, Taylor.
Can you move money around it from line item to line item or no?
I may be able to, I can't promise that. With their timeline, there is, it's simple enough. I just don't know if there's time that they would approve it. I definitely can ask Cassandra if there's a possibility for that.
I was just curious because there's like conferences coming up that you could use it towards, like APHA and stuff like that. So,
Are any of them before June 30th?
oh,
Yeah, so
Okay.
everything's got to be in hand by June 30th. We're following that hard fiscal. year.
okay.
Yeah.
I don't think so.
Okay.
Just not a thought, but I'm wondering, can you send this when you have it all finished to us?
Mm-hmm.
Thank you.
Yeah. And so I think we could sort of roll on to that, sort of closing out our budget line item of the fiscal year 22 expenditures. Our proposed budget for fiscal year 23 is, I'm assuming, and I'm waiting for confirmation from Sam and B&A, our contracted nursing services actually goes up. This was a prorated amount that did not include 2 months. So it will be the full 130. And our health inspector, I'm still working with the state on how best to merge those line items in terms of how to represent that. We'll obviously have the software line item. There's not a lot of room. There's really nothing left in this grant once we just go in with our shared inspector, our nursing contract, the software, and it's really gone. Because remember, this grant year we received the extra 50,000. So our grant next year is 300,000. So I will be circulating that draft. I don't have it yet. We're assuming the nursing line items will be identical, but there's not going to be a big budget for training or any of that. However, the next grant on our next agenda line item does have some ability for that. So I wish I was further along and having everything done. We're just not there yet. So we'll have some discussion, but everything's going to be very tight. These grants, we did receive confirmation. We're going to get the same amount of money, the 300,000 on the PHE grant. But there's no room for like escalation or increased cost to benefits, or, you know, the fact that, you know, the health inspector line item, obviously there's cost of living adjustment, possible merit increases and things like that. Those are really locked in. So I'm going to, what's that?
It's very good.
All right.
Well, I know it's a lot of work.
Yeah. Oh no, I appreciate it. So we'll it's pretty good. It's going to be pretty vanilla for fiscal year 23 for that grant, but no changes. We'll have the 1.5 nursing and the health inspector line for sure to keep up with those. So, and then on staffing update, great news. Erin will be coming back from maternity leave on April 15th. So if you can all remember, we had voted and we had backfilled that position with the contact tracing staff. So we're going to be back up April 15th to the full 2.5 nurses. And so I need, well, there's going to be a lot more capacity. So I think we need to think creatively on how are we using our nurses? Are there other roles? How can we better support your health departments? We will have additional staffing. So if there's the home wellness visits will continue. And so that will be taking some of their time. We don't really know what we'll be seeing, you know, in the fall in additional contact tracing demands. But the good news there is we'll have Erin back, and then our shared health inspector, Northboroughs, interviewed. We have, there's several candidates there, and we've hopefully going to extend an offer very shortly, and we'll have an update to all of you. So Experienced Canada, I've talked in, you know, separately to Southborough Health Department staff on that one, but I think the candidates we're looking at would be very equipped to do fabulous food inspections, and that's really the top priority, that inspectional position. And then lastly on our agenda is the DPH regional training hubs. I don't know if you've heard about these on Tuesday. They lightly touched upon this at the DPH meeting. So the state is looking to set up 10 regional training hubs across the state. They're going to hire senior trainers that are DPH employees that will be developing curriculum to provide in-field training on food, housing, and septic. At this point, they've identified us as Greater Boroughs as a possible regional training hub. I did have a conversation with our coordinator, Cassandra, and it wouldn't affect anything that we are doing. It's really a decision if the town of Northborough would want to serve as a regional training hub. So it's really a separate contract where Northborough could look to hire contractors that would be trained by the state and provide local training to our area. So we really don't have many details. Northborough's not 100% in or 100% out. We're waiting for more information from the state. Want to keep you guys in the loop. As that develops and we learn more about it, we'll look to invite you to any working sessions on that, but it wouldn't impact any of our staff. It really is a whole separate contract, not under the IMA, but between Northborough and the state. And so I think there's 10 identified. Worcester, Connor Robichaud and his group at CMRPC, maybe another regional training hub. I think where I'm hesitant, I'd love to have local training for everybody, but there's not a lot of people out there to hire that are qualified to do the work. There's not enough people left in public health. So we need the training, but who are you going to hire to do it? And especially if they're a contractor, it's not as attractive. So the state is saying that they have about 1.5 years of guarantee of those funds. And so there's no way that towns could hire full-time employees because it's just not a long enough window to really look at it. So I'll keep all you in the loop. If you want more information, please don't hesitate to reach out. But the state's development of this program, it's really a state level program. The goal is they want people to have trainers in the field locally, that they don't have to drive all the way to Boston or all the way to Western Mass if they want to shadow a septic inspection or shadow a food inspection, those sort of things. Any other topics or conversations on the Public Health Excellence Grant? Okay. So we're moving on to our local health support for COVID-19 case investigation and contact tracing grant, which is called the contact tracing grant. So again, this follows more the federal model. If we have unused funds, we can roll them to fiscal year 23, which of course I'm going to do and request. So we don't, all of my focus administratively has been trying to spend out the last grant and not as worried about this grant. There's going to be plenty of funds rolled because of the backfilling of covering Erin's maternity leave. Although we do have Isabella full-time right now with us this summer, that's not using all of it. So the goal is as I build the budget for fiscal year 23, we'll circulate to you. I want to look to maybe do the same thing and see if we can make Isabella again full-time next summer. And just sort of, I think our best investment right now is in staff. And that's where I want to focus that grant. And then anything remaining, as I said, we're going to be tight on that PHE grant, but we'll have a budget or medical supply line or those sort of things. So ordering of supplies would likely be possible through that second grant, that contact tracing grant. So the state's continuing, they're going to give us the full allotment of the $160,000 for next year. So there's no changes again to that grant amount. It's going to be fairly identical. And any remaining budget, aside from penciling some money to keep bring Isabella maybe even next summer back again, I'll probably put the additional remaining funds to sort of balance out the 160 if there are that we've rolled over into a per diem nursing line item as well as the supply line item. There's a lot of flexibility with that grant, that if we need to move things mid-year because we got to buy test kits or we need to buy more masks for our schools or our community or our police department, we can move between those line items with a simple email. So there's some flexibility there. So on expenditures, again, we are not going to be fully expended on that grant. Obviously, we did spend a lot of the PHE items, like the sanitizers were purchased and distributed to you, the canvas bags, all those essential protection kits, all those purchases were made. So really, we'll just be rolling mostly the unexpended nursing line item funds from that position over into fiscal year 23, but everything else was pretty well spent out. And so I can send you a follow-up before I submit anything to the state. I'll make sure everybody gets a copy. And if there is a need to hold another meeting to take a look at it, I'm happy to do so before those fiscal year 23 budgets are due. So any questions on the contact tracing grant? The nurses are still supporting towns. you need additional assistance. We really are scaling back the contact tracing, as all of you know, and focusing towards these new wellness checks, which is our next agenda line item. So any other questions?
Nope.
Okay. Let me see if I can pull it up here. I could just sort of do a show and tell. So one of the things that was discussed, was it just last week or 2 weeks ago, we held a meeting with our Salmon BNE nurses to talk about the home wellness checks. So those are underway in Boylston and Northborough.
Yeah, in Westboro.
In Westboro. Okay, so Jim's out. Are you also having the other nurses? Jen, so just Jim for now. Okay, and if there's, this, we do have additional nurses available. So if you find the list grows, and Jim can coordinate directly with Salmon BNA on that. And then Southborough, any updates? Do you know are you doing any of the home wellness checks yet or referrals?
We had a meeting and our senior center was going to get a list together of potential people for Penny to reach out to.
Okay, great. Thank you. And Penny did pull together, this is a little pamphlet. I'll be sending all of you. This is not a final. I had to print it. We were playing, and we were making sure it's going to fit in an envelope. The goal would be that it's a two-sided, cardstock pamphlet. Really, the front is talking about what takes place in a home wellness check. What would they do? We give out free test kits, et cetera. We have the 4-town logos, just going to print one set, hopefully. And then the back, I think the most important thing is, who are we, right? There was confusion in Boylston. Like, are you with Boylston, or how are you connected? So we drafted a statement that the Greater Boroughs Partnership for Health provides public health services to the communities of Boylston, Northborough, Southborough, and Westborough through your local board of health. So we sort of go along. So I'll send you this now that it's finalized as of last night.
So I have a question on that. You state that you're passing COVID test kits out on that?
Well, we do say distribution. It just says sanitation supplies, providing testing kits and masks. We want to make it timeless. So that's a great point, Jen, because I think, well, what about in like 6 months and they don't want testing?
Or even now, I'm out.
Well, I'm hoping the state, right? When are the state kits coming? Does anybody know?
I heard September.
I heard 2 weeks, but that was the press release, so it might be different.
Okay.
Well, let's hope it's 2 weeks, not September, because if it's on that, I can't offer it.
Yeah. So definitely take a look. We could just say, we can make it definitely generic. We want it to outlive. I don't want to make the pamphlets every 2 months.
Right.
So we'll see where that goes. And then for each community, we need to know the referral phone number, so in your community, is it going to go through your health department, is going to go through your senior center, because we want to make it simple for seniors. So the goal of this is that the fire department went to a home where they thought maybe they could benefit from a nursing visit, that they could just leave this pamphlet there. And then I think while we're trying to make it fit in an envelope, the idea, and it was brought up in Boylston, that they don't know who we are, that we could put it in a town envelope. So it's going to fit in a town envelope. If the senior center has a list, they can just put this in there and mail it to them, so they know about who we are. So that's our update on the home wellness checks, but hopefully that's a way that we can keep our nurses engaged, better connect with the community, and support fire and senior center and collaborate. Any other questions on that home wellness check program?
Nope.
Okay.
I just think it's great. So.
All right. Yeah, we definitely want the feedback. So keep it coming. We'll all learn from one another what's working, what's not, and definitely think through if there's additional supplies that are identified. We do have some supply line items. And next, I'm really going to hand over to Isabella to talk about our summer internships and introduce Ariella. We just want to give you a brief update about our summer interns.
Perfect. So we have 2 interns. Ariella is our first one, and I will let you introduce yourself. We're sitting in the same room in 1 minute. And then our other intern, who has not started yet, is a UMass graduate or UMass master's student, MPH program. She lives locally, and she will be working on health communication and education materials. So any topics or information that you guys would like throughout the summer or even throughout the year, please let me know, because we'll be making a Google Drive and we'll have access through that for the rest of the year. She's only going to be working with us for a couple months, but we'll have access to all of that. But Ariella, if you want to introduce yourself.
Yeah, hi everyone. My name is Ariella. I'm a first-year MD and PhD student at Tufts University, and I am going to be working over the summer. Should I say a little bit about what I'm working on? Or okay, I am working on the planning for the COVID vaccine clinics for kids under 5. The FDA is actually meeting right now to hopefully approve the Moderna and Pfizer vaccines. And so I've been interviewing different provider offices around the area to see who is planning to offer the vaccine and what types of support they need from local government in order to best meet the needs of the community, and then potentially working on some educational materials and also looking at pharmacies and urgent care centers as well.
Great. I have a question. Ariella, what communities have you reached out for so far?
So I've been collecting, I have a list of offices in Northborough, Southborough, Westborough, Hopkinton, Holliston, and I think that's it.
Okay, great. Thank you. Can you relay some of the information that you've obtained of what they're doing?
Yeah, definitely. Do you want that now, or do you want me to send a write-up?
If you could just give us a brief thing right now, that'd be great.
Yeah, sure. So what I'm finding based on what I've heard so far is that most of the bigger provider offices are planning to administer the vaccine, but only for existing patients. So some of them are going to be running their own clinics, especially the Reliant Medical Group. But that is only for existing patients, and they are mostly doing it through these clinics and not through routine patient visits right now. They also haven't had a lot of people reaching out yet about any of this, so it'll be interesting to see what the demand is like. And it sounds like the biggest barrier that they foresee is the hesitancy piece and the education to parents around the necessity of getting the vaccine.
So is part of your role creating like website material to educate our parents that we can put on our websites and our Facebook page?
Yeah, I think we talked about doing some of that, as well as trying to come up with a list of just which offices will be offering the vaccine for parents who aren't sure where to go.
Perfect. Thank you so much.
And our other intern can also work on that, because I do think that's very important. I know Arielle and I were just listening to the meeting that it's like 8 to 5 today, and they're talking all about the vaccines and just like, Pfizer, Moderna, and different people, just which one they want, which one they would prefer. One's 3 doses, one's 2 doses, different times between each one. So it will be interesting to see which ones get approved and what parents prefer.
Great, thank you.
I just want to know, in addition to providers, Arielle is also going to reach out to the pharmacies and minute clinics. So although you have like the 3 and older for pharmacists, if there's a minute clinic, and just if they have recommendations on how best to schedule. So my goal that I would love to be able to produce is just to say, okay, in Northborough, like here are the closest places. It might be the Westborough CVS or the minute clinic there, just letting them know that there's choices, and then really taking the relationship Isabella has developed with our daycares, and then really directing that. Would you hand out this flyer? Could you circulate this information to your families? Same thing if the schools would help to distribute that. So our goal would be, we don't have to run the clinics. We just point people to where they can get it.
That's perfect. That's what
if there's gaps, I think we need to reconvene and say, how do we fill those gaps, and what does that mean? So before we start spinning our wheels and, setting up clinics, I think we really have to figure out what's out there. I don't think we'll know the demand right away, but the complementing the vaccination opportunities.
I'm in certainly no hurry. It's been this long. I don't think a little bit while longer to wait is going to be an issue.
Do you have a listing of all the parent groups for all of our towns, so that you can reach out to all of those?
I don't think so.
Okay, I can provide you with what I know of. And so then at least you have a contact at those, and then they can distribute to their network.
That'd be good. And then for other towns, Chelsea, like Northborough, do you think do you know of a person that may have them?
Yes.
Okay.
Yeah, I'll try to get as much information as I can about the other towns. I obviously I know the Southborough people, but I do have a few contacts in the other towns that I can reach out to. Yeah.
Great. And the state was talking on the DPH call on Tuesday. Obviously, they're working on their whole campaign, and we're not going to look to recreate the wheel, really just to link to those resources or just figure out which FAQs are most applicable and just fill in that information as needed. So again, just like Isabella said, with the public health education materials that Nazari is going to be working on, tell us the format you want. If you want it, a box or a flyer, or this is how our website, whatever you guys know or use. we want to make sure we make it easy for you. So more to come. And we'll definitely look to proof all of that material, that will be sent to health directors if there's comments or feedback. I would like that we would just do a consistent message of here's everything available in our 4 towns. But I'm sure you could work with the interns and Isabel if you want to customize that as well for your particular community. Okay. Any other questions for Ariella or for Isabella in general with the interns? Okay, well, thank you, Ariella, for coming on. We're really excited to have you. It's such a great resource. There was also a Metro West Health Foundation meeting that was earlier this week, and they were talking about the pediatric vaccinations. And so they were excited to hear that Ariella was working on this and really looking to figure out what's happening in our area. Her results will also be forwarded to the Metro West Health Foundation, and they're a great resource for not only funding if you need to do anything, but also connecting us to practitioners or other community health centers, et cetera, where we may be able to send our residents. One other update, that's just about vaccinations in general. While I know Jim was successful, Jim Frederick in Westboro, working with the schools to offer immunization sort of catch-up programs. With the schools, I heard Ashland. I talked to Ed Berman, who is doing well. He's not with the public health anymore in Ashland, but the Ashland Public Health is one of their nurses, and they are running a clinic every single week, a catch-up clinic for immunizations. And so I'll be reaching out to Raj, their health director, and circulating that to you. So again, these are for individuals that maybe just need to play catch-up, don't have a primary care, and are looking for that information. So if they're willing to take our residents, I'll look to circulate all of that to you, because I know in the past in Northborough, we've sent them to the free clinic at St. Anne's in Worcester and some other, but now that Ashland's running that, it might be another option for our school children and our schools and where to send them. Obviously with COVID, a lot of people are behind on vaccinations, and the schools are going to want to see them up to date for the fall. Okay, so if we're moving on from COVID vaccinations, our next agenda item is our community health assessments. On the agenda, I just wrote discussion on community health assessment scopes, funding options. I know obviously Isabella had provided materials to all of us. I thought this was just a good opportunity for an open discussion. Sort of, where's your town? Where are you guys in considering a health assessment? Isabella's here this summer to assist any of you if you're looking to look into that further. I think where we left it, or maybe Isabella, you can fill us in, or Jen, you've got further along in realizing quite how expensive it was. Can you speak about what you found with the other community, Jen, that big $120,000 ticket line item? I was sort of shocked by that.
Yeah, me too. So I presented it to the town manager to receive ARPA funding, and right now it's on hold to find out what towns are doing, because it's going to be cheaper apparently, like Isabella said, if we do it together. So right now it's on hold. I don't think the 120 will get approved. I think probably 80 would, but not 120. I do have some remaining money I probably put towards it, hopefully in the future. But also Isabella's willing to help with grants or presentation. So that's where I'm at. I'm waiting to hear what all of your plan is.
I can speak for Southborough, where we're at. So we discussed it at a board meeting, and we're definitely interested in doing it at a regional level, or at a minimum, a local level, if we can get the funding to do it. But we definitely would be interested in doing it at the regional level. We have not officially requested ARPA funding for this because I don't have a hard number, and I didn't know how to explain if it was going to be just for us or regional, because I didn't know where you all stood. So I think we're open to wherever this board wants to go.
And Sarah, have there been any discussions in Boylston about a community health assessment or ARPA or any of that?
I don't have any information about that right now, but I can certainly send an email out and get back to all of you.
That sounds good. And Northborough, we're much earlier in the phases of ARPA discussions. I think Southborough and Westborough, you're months ahead. And listening sessions, we actually have our first formal listening session on tomorrow. So, haven't gotten to detailed discussions. I did bring up the community health assessment with our Board of Health here in Northborough. They're very interested in thinking about that, trying to come out stronger from the pandemic, and where are the needs in our community? How do we build better public health infrastructure and support our residents? But again, we're so early in the phase. I personally wonder, 120 just sounds like 120,000 per community or whatever that was found in sounds like so much money. Obviously there's all the procurement, and, I don't know if there's a middle ground. Like, we're not one of those big health departments like a Cambridge seeking public health accreditation, and we need this massive, exhaustive. I wonder if there's a middle ground. I know on the vendors, there's not many vendors that do this, and there's one in particular, and that was the only one. What town was it, Isabella? That there's only one bid, and it was.
I think it was Acton.
It was, I spoke to Andover, and they were gonna do it with, the Andover other town right next door, and they were gonna do it together.
Okay.
And they only got a bid from Health Resources in Action, which is the same individual I spoke to. I reached out to John Snow and haven't heard back, but most of them are done by HRIA.
Okay.
But if you know any other vendors, I can definitely reach out just to understand kind of what they do and get examples.
The HRIA, Isabella, is that the vendor that did the community health assessment for UMass system, like the UMass Marlboro, or most?
Yeah, the Metro West one.
With the Metro West, yes. And so I know, Isabella had researched that and found, like, in Northborough, I think we had 7 residents were included in that community health assessment. So it wasn't, although there was a health assessment done, it wasn't really representative of this area necessarily. It was a really big window done for the hospitals. I think for me personally, I'd like to sit down with HRIA in a Zoom meeting with other members of this, group to really talk about what they would do, and is there a way to scale it back or regional? What could we, I know it's a little putting the cart before the horse, but I think the best part is to have a conversation with them about what are our options. Maybe we could scale it back, something regional, where it's not going to be $120,000 project. Would you be interested in attending? Is that something you would find useful if we were to have Isabella try to put together a Zoom meeting?
Yes.
Okay. So Isabella, on your to-do, does that sound good? I think we'd say that we're interested as this group talking about conducting possibly a regional health assessment, but want to better understand scope, scale,
and the right cost. Like, we have to get that cost.
Yeah.
Or
I also think it'll be helpful for us to understand exactly what we're going to get from this. So I think something that Southborough is struggling with is, how do we balance staffing between local and regional, and what's the right balance for the next 5 to 10 years, and how do we get that to be sustainable? So I think that's at least from our town, one of the biggest hurdles that we're facing from a public health perspective.
I would say Northborough's, very similar. So great. So we'll try to pull that together. I think definitely by Zoom. I know it's summer, so we probably, even if we can get them to agree, Isabella, I think with everybody in vacations, we might need to do a poll to figure out a time where we could try to get representation. Because if we don't have all 4 towns, I just don't think they're going to want to meet with us again. So we'll try to do it as soon as possible, where you can have representation of the 4, health departments to learn more about that. And I would say go ahead and extend that invitation to whoever would be appropriate. Okay, perfect. So that's one of our to-dos. So I think that is really it. I'm working through our agenda, and now we onto our approval of meeting minutes from our March 9th meeting. I did send those to you all late last night. Sorry for the tardiness on that. Were you able to take a look at them? Okay.
Yes.
Okay, were there any edits?
Motion to approve the meeting minutes.
Second?
March 9th.
March 9th. Okay,
And I'm going to abstain.
okay. So I could-
Malinowski's aye.
say that one more time, Chelsea.
Oh, sorry. Did you want me to, were we voting?
Okay, yeah, did you second that?
Second.
Okay, we have a second. Okay, and we'll do a roll call vote. Kristen Black, aye.
Jen Sullivan, I.
Chelsea Malinowski, aye.
Okay, and Sarah Boylston has abstained, so those meeting minutes are passed. Okay, and next on the agenda is to confirm our future meeting dates. So again, just to remind everybody, these are quarterly meetings. I just sort of penciled for the second Wednesday. We did get bumped this month because of a GBPH meeting last week, so thanks for being accommodating. But we're looking at a September 14th, December 14th, March 8th, and June 14th. I know they're a long way out, but I just want everybody to mark them on the calendar. We'll see if Zoom's still allowed at that time and really make an assessment in September on the best format for that. I'm happy to host at the Northborough Senior Center like our previous meeting, or just let me know if you'd like to host as well. We're only doing these once every 3 months. Again, if there's a need to do any, if you would like to hold a meeting to go over budgets in more detail or anything like that, as those drafts are circulated, please don't hesitate. I think if we have any interest from any member to want to hold a meeting to vote that, we'll just go ahead and do the same thing, and we'll do it via Zoom and focus on the budget. Okay, so those meeting minutes, those meeting dates are good to go. And then really question, discussion, or any other business that could come before the board. Okay.
Kristen, when did you say that Erin was returning from maternity leave?
She is returning on August. It was August 15th.
Okay.
And she's going to come with a new name, so don't get confused. So she officially, changed her name. She finally, I guess, had the time to do the paperwork. So anyway, Erin has a new name. I should know it. Do you guys remember what it was?
I don't.
I sent it to all of you, her new last name. But anyway, it's in an email somewhere. So yeah, Erin will be back, and we'll I'll provide additional updates before she returns, really on the plan with the staffing and contacts and things like that. So it won't be, we're not getting rid of anybody because we've just been backfilling and a little short staff, but I really do want you guys to think hard of their projects you're working on, where we want to pull the nurses in. The home wellness checks, we'll keep them going, but if there's other resources or expanded hours, that sort of thing. One thing I'm considering for the fall, I want to pick your brains. If we have the nursing capacity, one thought I had was to do standing clinics with just like one nurse, appointments every so long if we're gonna through the fall. For some of our boosters, could be an option. We want to keep the nurses going, so it could be, what we say on Southborough, we'll have a nurse over there at your senior center and offer booster appointments on Monday mornings or something like that. So we'll talk more in the fall, but there is capacity, and those are the sort of things that we'd be able to do. Obviously, it takes planning, but keep thinking about projects for nursing, anything from substance use or other things on where you would need support. We will have the staffing. Okay, I guess that's it. If we have a motion to adjourn, and we'll be good.
Motion to adjourn.
Second.
Okay, all those in favor, roll call. Kristen Black, aye.
Jen Sullivan, I.
Chelsea Malinowski, aye.
Sarah Scheinfein, aye.
All right. Well, thank you, everybody, for your time.
Thanks so
Thank
much.
you.
Bye,
Have a good
everybody.
Thank you, Kristen.